Fluoride in toothpaste. Does it protect your teeth or destroy them? The internet is scary. Science says otherwise. Who really needs it? And how do you choose the right toothpaste? Today, it's a battle. Real dentists versus artificial intelligence. On the left, practicing dentists. Dr. Tatiana, Dr. Andre. On the right, their AI avatars. Numbers, scientific data, facts. Fluoride, enemy or protection?
Fluoride is an element that is already present in the structure of enamel. It increases resistance to acid attacks and reduces the risk of tooth tissue destruction.
In the clinic, we often see the early stages of enamel destruction, the so-called white spot. It is specifically the fluoride that allows us to effectively stop this damaging process. And it significantly helps to restore and strengthen our natural tooth enamel.
Fluoride forms fluoropatite. Its resistance to acids is 30 to 50% higher.
Fluoride reduces enamel demineralization by 25 to 40% and speeds up remineralization.
Does this actually work in real life?
In our daily clinical and practical work, we have frequently observed that patients who regularly use fluoride toothpaste tend to develop dental caries much less frequently and with significantly less severity. Fluoride reduces bacterial activity and makes enamel more resistant to their effects.
Patients who do not use fluoride toothpaste have a higher risk of developing cavities, especially if they frequently consume sweets.
Fluoride toothpastes reduce the risk of cavities by 23 to 25%.
Fluoride concentrations above 1000 ppm increase the effectiveness of prevention by 30 to 40%.
Watch the full video on our YouTube channel, My Mobile Dentist. So why are people afraid of it?
In medicine, everything depends on the dosage. Fluoride in toothpaste is entirely safe and effective when used correctly, and it remains one of the most extensively researched and rigorously evaluated components of modern preventative dental care today.
It's important to understand any substance becomes dangerous in excess. Fluoride is no exception.
Fluorosis occurs when there is excessive fluoride intake during the period when teeth are forming.
If recommendations are followed, the risk is minimal, less than 1 or 2%.
Are all forms of fluoride in toothpaste the same?
No, not all forms of fluoride work the same way.
In everyday clinical and practical work, we consistently observe and find that it is specifically aminofluoride that demonstrates a superior ability to adhere much better to the tooth surface, providing significantly more durable and longer-lasting protective effects on the enamel. This is especially important for patients at high risk of developing cavities.
Aminofluoride increases the contact time with enamel by 20 to 30%.
Sodium fluoride is used more often because it is less expensive.
How do you choose the right toothpaste?
There is no universal toothpaste for everyone. It all depends on age and the risk of developing cavities. The higher the risk of cavities, the higher the fluoride concentration, but only as recommended by your dentist.
Selecting the right toothpaste is a crucial component of an individualized dental prevention plan. When selecting toothpaste, we take into account the patient's age, the condition of the enamel, and the clinical situation in the oral cavity. And only after that do we choose the concentration and form of fluoride.
Recommendations for fluoride concentration. Children from 6 months to 3 years old, 500 ppm. Children from 3 to 6 years old, from 500 to 1000 ppm. Children 6 years and older, from 1000 to 1450 ppm. Adults, from 1450 to 1500 ppm. For high risk of cavities, up to 2500 ppm, strictly as prescribed by a dentist.
Toothpastes with low fluoride content reduce the effectiveness of prevention by 20 to 40%.
Fluoride, harm or benefit?
Fluoride is a clinical tool, and when used correctly, it reduces the risk of developing cavities.
Fluoride is not just a preventive measure. It is one of the key factors in preserving and strengthening enamel.
Up to 60 to 70% of cavities can be prevented with regular use of fluoride-containing products.
Personalized selection increases the effectiveness of prevention by 30 to 50%.
Remember, fluoride works effectively only if it is used correctly.
Choosing the right toothpaste truly reduces the risk of cavities.
The form and concentration matter.
An informed choice is the foundation of dental health.
Today we discussed an important topic, the whole truth about fluoride in toothpastes. Sometimes the problem isn't with the toothpaste's ingredients, but with choosing the wrong one. The main thing is to understand what suits you personally. Stay with us. In the next battle, we'll cover another topic you definitely need to know about. When the experience of real dentists and artificial intelligence come together, the patient wins.